At CancerCare Nova Scotia, we believe it is essential to have cancer patients and families actively involved in helping to improve the cancer system. This involvement is often referred to as patient engagement. Patient engagement is important because people with cancer, families, and friends have unique and valuable perspectives to share about cancer care. It is important to hear from people who have been in contact with the cancer system in order to see what can be changed to better meet people's needs. Sound interesting? Let's discover what patient engagement is about.
Patient engagement is an attempt to balance the power that tends to exist within the medical field between the doctor or physician or nurse and the patient. So that in one way or another, in one concern or another, be it small or grand, the patient is respected as a partner in terms of that and not looked upon paternalistically, maternalistically, however you want to phrase it.
In the past, we would build programs that basically met the needs of the district or the needs of the, not necessarily the community, but the resources we had within the community. Today we see that we're taking a different approach, and we know that by engaging patients, getting their points of view, families' point of view, we can better tailor the program to meet those needs, and the outcomes are much more favorable.
Families have a great concern, sometimes even more than the patient. They just want to lighten the load, take the burden from the patient. They have great insight and perspective because we as healthcare professionals are educated in cancer care. We think we know best, but unless we get the input from the patient, we don't know that.
The biggest thing that we need to remember is that the system and the infrastructure that's been set up for cancer care and healthcare in general is pretty good. But the driving engine behind them is the people. And the people in the system, they're motivated, passionate people. And they care a lot, and they will walk over coals to get the proper care done. But we forget that there are motivated, passionate patients as well. And a lot of these people, either during their care, especially after their care, and they're very grateful, they want to contribute. And they're motivated, passionate people out there that we need to tap in on and get their feedback and their energy to help improve the system, not just people sort of in the healthcare team. So I think that's the single most message. There's an untapped resource out there that we need to optimize.
CancerCare Nova Scotia, we really value patients' voice and patients' experience and have created the Cancer Patient Family Network. And the Cancer Patient Family Network is an opportunity for cancer patients, survivors, family members, and friends to share their experience and contribute in system improvement initiatives. We don't come together and meet as a group. The network is kind of a virtual network in a way, where we have membership from all across the province, and we don't physically come together, but it's really about that sharing of information and sharing of opportunities for people.
They are given information from the Cancer Centre, but this program is solely to get information from patients so we can change things and make the care the best that it possibly can be.
It's really important because people that have experienced the cancer system firsthand have learned about what works, what doesn't work, and what might need to be changed. And so we look for opportunities to hear people's perspectives and their opinions and let us know what might need to be changed and what isn't working well.
Everyone has a story with the healthcare system, and there's many good experiences, so I think it's important to enhance those, I guess, and then people have negative experiences, and I don't think that we just have to sit back and accept that that's the cancer system and we have to put up with all of that.
Well, you might be asked to get involved in focus groups. You may be asked to get involved in workshops. Those are some of the things. And also, your ideas about what happened to your story.
One of the things that's really important to us is that the opportunities that we have are meaningful for patients, so that people are heard, they feel valued, and that it's beneficial for the patients and for the system as well.
We're really lucky in Nova Scotia that we have this opportunity to be involved, And so I think that if people are able to say what challenges they faced along with what were the good points, then we can help to make sure that it makes it easier for the person that gets diagnosed tomorrow.
Some people are very private. They don't want to talk about themselves. Some people, it's transportation. People return to a healthy lifestyle and they want to go back to work and just forget all about their treatment.
Certainly after the first cancer, I didn't want to have anything to do with hospitals, with doctors, with cancer, with volunteering, with getting involved in anything related or in any way touched by the sights, sounds, smells, and ideas of cancer. I just wanted to forget it.
Patients are reluctant to criticize the healthcare system, and particularly physicians, because they might feel it would impact on their personal care, compromise their care somehow. So there's definitely some reluctancy there.
Well, I think we need the voice at the table of the Black African Nova Scotians, because the Family Network done a survey, and they done workshops, they done focus groups, and we weren't there. When the stats come in, we were missing. Native people were missing. So when I came into the group, they asked me is there any way I could sort of draw these people out? Because I know there's a lot of Black people with cancer, and they should be with people that, like myself, who've been through it and can have support.
I think definitely that a lot of people feel like they'll be involved in saying what they want and it won't actually make a difference. Like the system's almost too large and scary beyond what they have the power to do something about.
One of the things that we learned was that it's not always easy for patients to get involved. Sometimes it can be hard, sometimes it can be intimidating speaking up or sharing their story or sharing their experience. And what we hear too is some people say, does it really matter that I share my story, or is my input really going to matter in the long run? And what we say back is that Cancer Care Nova Scotia, we really do value the patient's experience. It's really important, and part of what I'm here for and the Cancer Patient Family Network here is to help provide the support for people so that they can participate. We see a number of examples where the voices of patients have definitely had an impact on what happens in Nova Scotia. The Cancer Patient Navigation program actually came from some focus groups and roundtable conversations that happened with patients and families back when Cancer Care Nova Scotia was formed.
Our teaching program has been changed considerably to meet the needs of the patients. So we do group teaching if they're able to come as a group, and we can tailor it to one-on-one teaching, whereas before we would just, if they were in the chemo room, they were receiving chemotherapy, they would get all the information at once, they would get the teaching at once, totally overwhelming. So we listened to what the patients were saying. And as a result, we've changed the teaching program. We see the value of having the patients as part of the committee members, as part of the team, and part of the decision making, so that we know that we have it right. So just not, the doctor model, the medical model, or the administrative, saying this is how it is. We want to hear the voices of the patients if we're ever going to be successful in transforming the structure of healthcare.
When we design the clinic, primarily the patients are our main goal, our endpoint. So all the stuff we do in terms of service, setting up the infrastructure, really we need to know how the users see that from their viewpoint. So what we've done is taken that feedback and shaped the clinic according to what they see.
I found out again and again and again that the perspective of the patient is unique, and it's a voice that hasn't been heard as clearly, as forcefully as it should be. And I'm hoping that that voice will grow stronger and more confident with time.
What better way to give back to your community, to mankind, to your people, because we know that there's a lot of people out there who don't have any support. So I would tell them, I would also tell them about the fact that there's a little bit of work involved, but it's stuff that you know about because you've been there. And that's what I tell them, not to scare them off, but to let them know, like, it's just talking about and being supportive of something that you've been through.
I feel like people need to stay involved because you don't really often have the energy when you're going through it to be involved in trying to help others. So I think it's important to not just get through and walk away, but to really try to get in there and help make a difference for the people that are about to come through.
We've given you some examples of what patient engagement looks like, how people participate in patient engagement, and how getting involved can contribute to cancer system improvement. If you are interested in getting involved, a good place to start is by joining the Cancer Patient Family Network. If you are interested in joining the network, you can fill out a registration form on the CancerCare Nova Scotia website. As well, if you'd like to get involved in cancer system improvement, watch for opportunities to participate within your own community and district.